I'm Dr. Samantha with Walk the Natural Path, and today we are going to talk about sex and fertility. So hello, welcome to my channel. Today we're going to talk about sex and fertility. So there's all those tips out there. Let's give you some practical tips that are actually going to help you conceive while trying. So one of the first questions is, when should you have sex, right? This is going to depend on your ovulation time. So we're going to talk about that in a little bit. But first, if you're a couple that's having intercourse, let's say every single day or even every other day, odds are you are going to hit that fertile window, no problem. Timing might not be as big of a deal right now, or actually tracking your cycle, figuring out when ovulation is, might not be super high on your to-do list, right? However, if you're a couple who likes to have intercourse maybe once a week or even less than, it can be really beneficial to make sure you're timing correctly. Or if you're just someone who really likes to know more about your body and your cycle, learning to track your cycle is also great as well. So how do you know when you're ovulating? Some people honestly feel when they're ovulating. They can feel a little ping in their ovaries. Sometimes they will have some breast tenderness. Everyone experiences it different, but for me, I find the most reliable way to track ovulation is through cervical mucus and basal body temperature. I actually have a free ovulation tracking guide that kind of lays this all out for you. I'm going to put that in the description so you can click on that and use that. I'm a visual person, so it's always helpful to have something that I can actually look at and read. So that's there for you, but let's just talk about it really quick. So ovulation, on average, they say it happens on day 14 of your cycle. That's if you have a regular 28-day cycle, which I will tell you, majority of the people actually don't have. So how are you supposed to find when you ovulate? Some people like LH strips or ovulation strips. Personally, those aren't my favorite. LH is luteinizing hormone. That hormone can actually spike at random times of your cycle, leading to confusion when it comes to actual ovulation for some people. Ultimately, LH sticks are an option, or OPKs as they're also called, ovulation predictor kits. They can be helpful, but they're usually not on the top of my list. So my favorite methods are going to be basal body temperature and cervical mucus. 2 to 3 days before ovulation, you will notice more cervical mucus being present. At first, it might be like a dull yellow or a white type mucus, and then it will turn into that egg white-like clear mucus, or when you stretch your fingers like this, so it kind of stays attached. Usually I say it's very slippery when you wipe. That is ovulation mucus. That is usually ovulation day, you see that. Some people see it a day before as well, but most of the time people see it on that one day. After that, so basal body temperature. You take your temperature every single morning before you actually get out of bed. This can be very reliable in the sense of you are only going to get an elevation in basal body temperature if you have a rise in progesterone. Usually the only time you have a rise in progesterone is from ovulation occurring. So the reason why I say usually is people are on medications, people taking like birth control or progesterone can cause that spike. A lot of people are experiencing LUFs nowadays. I'll probably be making a video on that later on, but if you do experience it, you know what I'm talking about and you know what it can impact. With that being said, back to basal body temperature. So after the temperature rises, that usually means that you ovulated the day before. So straight temperature, and then all of a sudden you see a spike, usually means you ovulated the day before. So say we see a spike on day 16 of your cycle, that means that we are ovulating most likely on day 15. Now, day 16, what is that? What does day 1 even start? Day 1 is actually the first day of your period. And that means like a full flow, not just spotting, an actual full flow. So day 1 of your period is day 1 of your cycle. Then you kind of go all the way through. The day before your period starts is technically the last day of your cycle. So first part is follicular phase. Second part is going to be luteal phase. That was a very quick overview on ovulation tracking. Like I said, I have the free guide down below, but let's keep going. So what is the next tip, which is actually kind of the first one we started on, is timing. Okay, so as I said before, if you're having sex frequently, maybe you might not have to worry about tracking. I personally like tracking just because you know a little bit more about your body, or at least do it for a little bit just to understand how your hormones impact you. I don't know. That's a whole side note. That's the naturopath in me, right? Sperm can live up in the vaginal canal for 5 days. That's a long time. You're fertile for 6 days. So what does this mean, right? This means, one, having intercourse before ovulation is definitely going to prove more fruitful than trying to time it exactly on the day, possibly missing the 24-hour window. So what is the 24-hour window? When you ovulate, an egg is released and it's only viable for sperm to implant for 24 hours. This is going to be important because, like I said, you could miss the window on that back end, right? So most of the time I suggest couples have intercourse 2 to 3 days before their predicted ovulation. You can also have intercourse on ovulation day, specifically if you're starting to get really good at tracking and you're pretty sure your body is ovulating on the same day every month. But ultimately, having intercourse before is going to be great. I kind of say there's basically going to be sperm waiting for that egg to be ovulated, and it's just going to meet it rather than trying for egg and sperm to meet as they're both kind of going by each other. It's not exactly how it works, but I try to explain it in that way. Another big question that we're going to address, how often should you have sex? So some people say every day, some people say every other day. What's best? I honestly find what's best is going to be what's best for you and your partner. Super annoying answer. I know, such a naturopathic answer. Ultimately though, we're gonna say if you're having intercourse every day and that feels good for you, keep it up. If every other day works, that works too. Like I said, sperm lives up in the vaginal canal for 5 days, which is a long period of time. So every other day works as well. And if that seems taxing as well, remember that can just be done during the fertile window, during those like 6 days. So ultimately, it's not gonna be something that you have to keep up every single month. Another question that everyone likes to ask, does position matter? Short answer, no. There's not going to be a position that creates more likelihood of sperm meeting egg. That's a myth. But what does matter is ejaculation occurring, right? So we need the male partner to orgasm to send sperm into the vaginal canal. So position matters for that, but other than that, everything else is pretty much a wise tale. There's not definitive research on how female orgasm plays into it, but there is some research out there that does support that orgasm can help with fertility and getting pregnant. So I'm just gonna say it's always recommended. What about lubrication? So there are some fertility lubricants out there that are like, you need our lubricant to get pregnant. Not the case at all. Now, if you're suffering from vaginal dryness, I highly recommend using lubricant, not saliva. We want a water-based lube. Personally, I really like Good Clean Love. I think they're a really great brand and they have good, clean ingredients. Ultimately, the things that matter most when it comes to sex and fertility is going to be making sure that you time intercourse between your fertile window, which is 6 days, 5 days before ovulation and then ovulation day. That's going to be the most important thing. Position doesn't really matter unless, like I said, certain positions help, male orgasm occur. We need sperm to get in the vaginal canal to eventually swim to the fallopian tube, right? That needs to happen. Timing, if you're having sex every day, great. Every other day, also great. But just make sure it's within the fertile window. When it comes to lubrication, the reason why we don't use saliva is going to be it can change the pH. Water-based lube is going to be the best. And ultimately, I feel like there's a lot of other things out there. Sometimes people are like, I have to lay in bed for 10 minutes afterwards. You don't have to. You can totally get up, move around, use the restroom after. A lot of times people like to pee, possibly preventing a UTI, things like that. So if you like this video, please give it a thumbs up. If there's any other myths that you want busted, please don't hesitate to put them in the comments. I would love to help you out. So maybe I'll make a part 2. And don't forget to subscribe to my channel. A video is released every single Friday. Have a beautiful rest of your day.